As a child, do you remember coming home with a scratch on your knee from playing all day outside and your mom cleaning you up and kiss the boo-boo better? Then you both have been introduced to the power of the placebo effect. Research has shown that expectations can serve as a self-fulfilling prophecy for how well we recover, but there continues to be a debate about the role of placebos in medical treatment. Good evening, my name is Nicole Braceno.
I'm Heijin Kwan.
I'm Felix Ortiz.
I'm Riley Quinn.
And I'm Jorge Reyes.
And our question is, to what extent are placebos effective for treating American patients facing psychological and physical medical conditions?
Our thesis is that placebos have been designed to relieve specific psychological and physical diseases without an active compound. By reviewing the results of clinical trials, this treatment is justified to be highly effective in various types of settings.
And our primary solution is that the psychologist's main focus of their services should be on the client's health and safety. Providing alternatives to keep the patient aware when taking the placebo will continue the drug's efficacy and make the treatment ethically acceptable.
Placebos can be traced all the way from 4000 BCE with the Sumerians, with the doctors in their time recommending different pastes, brews, and fluids that in reality had no effect. Yet people simply believed that since the doctors were recommending it, that it would be effective. However, the first ever American/English trial was run in the late 18th century with an American doctor called Elisha Perkins, who developed two metal rods that he claimed conducted what he called pathogenic electric fluid away from the body. Dr. John Haygarth, however, thought the tractors were bunk and proposed to test their effects in a trial. To do this, Haygarth made wooden tractors that were painted to appear identical to Perkins's metal tractors. Haygarth then took 10 patients, 5 with the fake tractors and 5 with the real ones, and all 10 patients had positive responses. As you can see in the graph on the left, the placebos have been tested much more in clinical trials in recent times. The graph shows the United States, the green line, having a significant increase in trials ever since the year 1998. Moreover, the graph on the right shows the increase of pain in patients ever since, in the United States. The graph indicates that ever since the year 1998, the same year that the placebos were getting more frequently used, that pain has significantly decreased in the United States.
With placebos becoming more common in medical usage, it begins to start affecting those who are both aware and unaware of its use. People often make assumptions based on color and size of the placebo pill, which could be argued that cultural and social standards greatly affect your range of perception. For instance, a professor of medicine at Harvard Medical School, Ted Kapchuk, conducted an experiment to see if social factors such as warmth and empathy may help make patients feel better. In the experiment, there were participants assigned to 3 different groups, all receiving a sham acupuncture. According to the results, he states that such factors as warmth, empathy, duration of interaction, and the communication of positive expectation might indeed significantly affect clinical outcome. Therefore, a large aspect of administering a placebo is the nature of who gave it to you. In addition, your cultural environment, such as the manner of which you are raised or conditioned, can greatly determine what you believe would work as a medicine and affect the outcome of your recovery. In fact, through the use of branding, humans have been conditioned to associate medications with a specific color. Colors affect the perceived action of a drug and seem to influence the effectiveness of a drug. For example, as represented in the infographic called The Magic of Placebos, blue capsules make more effective tranquilizers, while hot-colored pills work best as stimulants, and so on. Moreover, a relation exists between the coloring of drugs that affect the central nervous system and the indications for which they are used.
The placebo is often utilized in double-blind pharmaceutical studies that are designed to test the effectiveness of prescribed medication when compared to a control. And as seen in the diagram on the right, in a double-blind experiment, neither the test subjects nor the scientists know who was given the placebo to avoid bias. This methodology tests if it is actually the placebo relieving symptoms, or if it's simply the perception of taking the medication, the placebo, that is creating the effect. To begin, the placebo effect can be a valuable tool in treating patients. Research by the psychology department at the University of Wisconsin found that in certain cases of depression, the pill placebo was nearly as effective as medication. Their investigations emphasized how using placebos in depression psychotherapy can be effective and conveyed how it may be useful in other patients with similar circumstances. And Public Library of Science's Lisa Gross also depicted how the placebo can be useful in neurological disorders such as Parkinson's, depression, chronic pain, and epilepsy. The biomarkers in brain biology support how the brain can predict a placebo expectancy response in the body. Alternatively, some research supports that treating conditions with only a placebo is not effective. The Department of Psychology tested the active placebo compared to the drug of caffeine. And seen in the diagram on the left, the placebo line shows a consistently lower pain reduction than caffeine and did not result in the same body response. And joint research by Harvard, Columbia, Cornell, and other universities investigated the effect of periomomycin compared to the placebo in treating HIV patients. And they found that the placebo was not effective and showed no treatment response during the placebo-controlled phase. These diverse studies emphasize how using the double-blind placebo-controlled phase is important to test the efficiency and effectiveness of medication.
There's controversy between the ethics of practicing a pill with no drug in it. Those facing psychological and physical diseases trust doctors' and researchers' judgment when seeking treatment. However, using placebos may cause an ethical dilemma for the provider and the patient. The bar graph on the right displays different response rates among academic internists and rheumatologists from Canada and the US when asked if they have been prescribed or administered a placebo in clinical practices. These shaded columns of Canada-based data reflects the percentage of respondents that 36% have prescribed vitamins, herbal supplements, and other forms of pure placebo, while the US data shown in blue includes 33% would much rather prescribe expensive antibiotics rather than placebo interventions. While less than half of physicians help limit the cost of healthcare, specifically US physicians apply a more expensive method such as antibiotics or surgery that may be equally effective as a placebo, but in this case are taking advantage of a patient who can't financially protect themselves. Unfortunately, the word placebo itself is synonymous with various negative words. Therefore, once the physician is prescribing a placebo pill psychologically, the patient will focus on the fact that they're receiving this occasionally less effective pill, in turn risking the efficacy of the treatment. For instance, I wouldn't take it if it was a placebo, as it is contradictory to what a placebo is. I don't believe it would work. This is a patient's reaction through a survey study suggesting a deliberate clinical use of placebos published by the US National Library of Medicine. The bar graph in the middle depicts different response rates of themes. Do you think it was acceptable for the doctor to try a placebo treatment in this situation? And in scenario one, many were deceived and said that 52% is deception, while the 47% thought it was transparency. Therefore, when participants were asked if a patient who had been given a placebo deceptively should be informed about the use of placebo, the majority focused doctors should not lie.
As more and more technological advances change in the near future, clients are being treated under ever-growing treatment. For example, in 1996, patients in clinical trials are only relieved by 28% data placebo, while in 2013, that gap slipped just to 9%. It signifies that in the past 17 years of experiment, placebos have grown more drastic than any part of the world. Another reason is that painkillers in most countries, while Europe has discontinued advertising to help these issues. However, American consumers are exposed to commercialized drugs, making it positive benefits from pain medications than Europeans. The explanation is plausible to the fact based on the mediated psychological factors. In the scientific experiment, they're conducting the double-blind experiment for COVID-19 expanding around the world, including America. In this graph, they're showing the interval curve based on the possible confidence in patients ranging from a 2 to a 4, and the rapid increase of placebo compared to the hydrochloroquine and azomorphs. It is possible for pharmaceutical companies and branding to use these techniques to conclude awareness of the placebo phenomenon on the ongoing phase of phase 3 clinical trials for COVID-19 therapies and vaccines will be crucial for this future.
Recalling back to the solution in the beginning of the presentation, providing alternatives to keep the patient aware when taking the placebo will increase the drug's efficacy and make the treatment ethically acceptable. However, bodies react differently. Those with serious chronic diseases may not experience great results, and telling them might shift subject expectation. While telling them that it is a placebo, it could possibly risk its power to flourish. Thank you. What questions do you have?
do have a question for each of you. Nicole, we're going to start with you. Nicole, tell me, how did the content of your presentation change as a result of you guys talking and planning?
So after talking, we initially agreed that the placebo was not as effective as medication. This was way before we even had a chance to read each other's essays and really understand all of our point of views. And so we noticed that once we created our rough draft in our presentation, we noticed that our personal claims on the slides did not connect with one another, and we had several gaps in between. So we thought that it was very important to go back and just completely restart at the beginning and decide what we should change. And in the end, we decided to change the anchor of it, which is our argument, and chose to a new thesis to ensure consistency throughout our presentation, which is why we chose that the placebo is in fact as effective as medication.
All right, thank you. Jorge, in what ways did you improve your ability to work with the group as a result of this project? Jorge, you have to unmute yourself. You pulled a beard.
I didn't hear what your question was. It lagged for me.
Okay. What way did you improve your ability to work as a member of a group because of this project?
I'm sorry. I'm sorry. It keeps lagging. It like cuts out your voice for me.
How are you better in working in a group because of this project?
Okay. Well, I was able to communicate with my group mates really well. Such as like Nicole. Nicole was able to like keep on top of us and really like communicate what our goals needed to be done, what we needed to be done, and in reality how to like really work through this pandemic as well as through our technology, as we're not able to meet in person. And so she really helped us bring everything together, as well as everyone else helped really play big parts in our group to really bring our presentation to where it is now.
All right, thank you.
Thank you.
Heijin, reflecting on your colleagues' work, which one had the greatest impact on your understanding of the issue?
I think that Felix's research had the most impact on me since I didn't have any prior knowledge of the historical background of the placebo, nor how it was used so far back. For instance, I saw that in his presentation and his IRR that the placebo has been all the way from 4000 BC, and I wasn't aware of the historical background of it and how it was even used in medicine from back then. So I think it really brought a new light to our solution and to our presentation argument, how the placebo was used even in past history.
All right, thank you. Riley.
Yes.
What was the strongest counter argument to your conclusion that your team thought of?
I would like to say, based on Heijin's perspective in the topic, she uses the clinical cases of placebos as they were effective in medicine. And the key factors were shifting to that success rate. And to use an example of that, it showed the prestigious investigations of caffeine when treating HIV, which was implemented as a limitation to our argument.
All right, thank you. Felix, now that you're basically done, is there any gaps in your research that you wish you would have addressed?
Yes, I would definitely say that I feel like we probably would have been better with like a little bit of an economic sort of perspective into this, because with the economic issues, we probably could have identified maybe even a better solution to our problem or a different limitation to our problem that could definitely alter like the whole thesis of our presentation.
You guys